Hello everyone, welcome to sqadia.com, and in our last section we will talk about uterine sarcoma. We will go over what is uterine sarcoma, what are different types of uterine sarcomas, and how they are treated. Uterine sarcomas are rare uterine tumors. About 5% of all uterine cancers are the sarcomas. They can be classified into pure sarcomas, mixed epithelial sarcomas, and heterologous sarcomas. So one is pure sarcomas, mixed epithelial, and then heterologous. Heterologous is different cells or different tissues are involved. Hetero is different or more than 2 or 3. Heterologous. This is the picture showing the uterine sarcoma. Then pure sarcoma. Pure sarcoma includes the endometrial stromal sarcomas, leiomyosarcomas. They occur mainly in the perimenopausal age. Patient present with irregular bleeding as in endometrial carcinomas. Sarcomas also have irregular bleeding. Then uterus is usually soft and it's enlarged in size. Low grade grading is not very high, and usually treatment is surgery. So it's a low grade cancer, pure sarcomas. Some common example is leiomyosarcomas, and they include endometrial stromal sarcomas. Age is usually in the perimenopausal age. The histological appearance of pure sarcomas here. Pure sarcoma, leiomyosarcoma, usually the mitotic count is more than 10 mitosis per high power field. So cell growth is very rapid in this type of pure sarcoma or leiomyosarcoma. Usually the atypical type of cells are present, cellular atypia. Coagulative necrosis is present, clotting or death of the cell due to coagulation. Median age is perimenopausal, so around 52, that's the time when menopause is about to occur. Then premenopausal, if the patient is premenopausal, they have better prognosis. Myometa and sarcomatous rate of 0.13%. That's the occurrence between leiomyometa and sarcomatous type of pure sarcoma. Is 0.13% is the ratio or rate. The survival rate for pure sarcomas is about 20 to 63%. So cellular atypia, if you see, atypical type of cells are present here. Next, mixed epithelial sarcoma. Mixed epithelial sarcoma, the most common type of mixed epithelial sarcoma is carcinosarcomas. Formally, these mixed epithelial sarcomas, they are also known as malignant mixed Mullerian tumors. Mixed Mullerian tumors. Postmenopausal, usually the age of onset of mixed epithelial sarcomas is 62 years. And usually it is associated with hypertension, diabetes, and the obese patients or obesity. It is very common or increased incidence in African American women have increased incidence of mixed epithelial sarcomas. 7 to 37% of patients have usually previous history of pelvic radiation who have this carcinosarcomas. The prognosis of carcinosarcomas is more than usually poor prognosis. It's 2 year about more than 2 year survival age is if stage 1 is present 50% 2 year survival, and for stage 2 is 10% 2 year survival, and if it's extrauterine it's 40 to 60% at diagnosis, then the survival rate is very, very low. So depending on the stages, 2 year survival rate in stage 1 is 50%, in stage 2 is 10%, and if it's extrauterine or if it's spread beyond the uterus, then it's 40 to 60%. Now, the third type of sarcoma was heterologous sarcoma. This is heterologous. Usually, it's the sarcomatous tissue, usually not found in the uterus. Its most common is rhabdomyosarcoma. It is present in children. Usually, it presents grape-like mass which protrude from the cervix. Recurrence rate of this is are high with distant metastasis. So if the metastasis is present, then the recurrence rate of heterologous sarcomas are more. So heterologous it consists of tissue other than the uterus. So it has different type of tissue which is not present in the uterus. Most common is rhabdomyosarcoma. Treatment of the sarcoma, it can be surgery or radiation. If it's surgery, depending on stage 1 and stage 2, hysterectomy should be done. Lymphadenectomy, which is removal of the lymph node, is indicated. All sarcomas except leiomyosarcomas. So hysterectomy is done, and then lymphadenectomy is done except in leiomyosarcoma. Then bilateral salpingio-oophorectomy is also done, not in usually premenopausal women. So depending on age, treatment is hysterectomy, bilateral salpingio-oophorectomy, and lymphadenectomy. And radiation usually is used, but it does not improve the overall survival rate, but it can lower the recurrence rate. So radiation is helpful to lower the recurrence rate, but no improvement in the survival rate with the radiation therapy. If there is recurrence of the sarcoma, usually again there is surgical excision is done if it's isolated. If it's recurrent carcinosarcoma, then the treatment is paclitaxel or platinum or ifosfamide is used. If it's recurrent leiomyosarcoma, then the treatment is with doxorubicin, ifosfamide, and docetaxel. These are some common drugs used for the recurrence of the sarcoma. If it's isolated, surgical removal is done. If it's not isolated, or if it's carcinosarcoma or leiomyosarcoma, then the chemotherapy is used. So that was all about the uterine sarcoma. It's what are uterine sarcoma and the treatment of the uterine sarcoma. Thank you for watching sqadia.com.